Hello guys, welcome to the ICD-10-PCS Coding Series. If you are new to the channel, please subscribe and follow the playlist from the beginning so that you understand all the root operations in ICD-10-PCS properly. This is part 31 of the Inpatient Coding Series, and today we will learn about the root operations in ICD-10-PCS coding. I'm Vinay Kumar. I carry an overall experience of 20 years in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for their medical coding certifications. I am dual certified from both AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. So today, at the end of this learning session, we will have a better understanding of coding the root operation reattachment from the fourth group of root operations. We'll also look at an example of coding from the medical and surgical section. And as I've already stated, medical and surgical section is the most important and biggest section in ICD-10 PCS. There are a total of 31 root operations in the medical and surgical section alone, and these root operations are divided into 9 groups based on similar kinds of attributes of surgical procedures. So, all similar kind of surgical procedures are grouped together, and 9 groups are formed. Today, we are looking at the fourth group of root operations. The definition of this group is root operations that put in or put back or move some or all of a body part. Now, there are 4 root operations in this group: transplantation, reattachment, transfer, and reposition. Today, we are looking at the root operation reattachment, which carries a character value of M. Root operations are the most important aspect of building an ICD-10 PCS code. So remember that root operations always define the goal or the objective of the procedure, and read the definitions of each root operation, compare them properly, and then finalize which root operation is applicable based on the procedure performed. Now, reattachment. The root operation reattachment is defined as putting back in or on all or a portion of a separated body part to its normal location or other suitable location. Now, procedures coded to reattachment include putting back a body part that has been cut off completely or avulsed completely. Okay, nerves and blood vessels may or may not be reconnected in a reattachment procedure. Some procedures require the nerves and blood vessels to be reattached. Some procedures may not require. These are examples of procedures that fall into the root operation of reattachment. Reattachment of hand, reattachment of avulsed kidney, reattachment of a finger, and reattachment of a severed left ear. Now, this is an example of coding reattachment procedure. The patient was involved in a farm injury and his left arm was severed to the elbow. The arm was reconnected with full revascularization and nerve attachment. Now, in this case, the patient's left arm was cut off to the level of the elbow, right? The arm was then reconnected, including connecting the blood vessels and also the nervous structures. So this is the corresponding table that shows the reattachment of the left lower arm. Section is medical and surgical. Body system is anatomic regions, upper extremities, because we are talking about reattachment at the level of the elbow, right? Now, note one important aspect. We cannot take any other body system for this example, like upper joints or upper bones or upper muscles, right? Because this procedure is done on multiple body systems. You need to attach the bone, you need to attach the joint, you need to attach the muscles, the nerves, the blood vessels, the tendons, right? Multiple things are involved. That is the reason we are coding this root operation to anatomical regions, upper extremities, and we are not coding it to upper joints or lower joints and so on. Okay, so the body system is anatomic regions, upper extremities, because it covers all the vital structures that have been reattached. Root operation is reattachment. Body part is F, which is the left lower arm. Approach is obviously open. No device for the sixth character, and no qualifier for the seventh character. So the code for the reattachment of the left lower arm is 0, X, M, F, 0, Z, and a Z. The root operation reattachment involves putting back on all or a portion of a separated body part, right? So for this case, the separated body part was the left lower arm. Now, the key points from this video. There are three body system values in ICD-10-PCS for the second character, okay, which are used when a procedure is done on body parts that involve multiple body systems, like anatomic regions general, anatomic regions upper extremities, and anatomical regions lower extremities. For example, anatomical regions general, this body system is used when procedures are done on body cavities like pleural cavity, thoracic cavity, and abdominal cavity. And anatomic regions, upper and lower extremities, are used when procedures are done on body parts that usually involve more than one body system or a body system value, like bones, joints, nerves, and blood vessels. All these together are worked or in the same root operation. Then you would instead go to anatomical regions, upper extremities, or anatomical regions, lower extremities as the body system values. This is the most important aspect for the second character that you need to remember. You'll find the online version of the ICD-10 PCS coding manual from this link. I have updated the link. My previous videos had the 2021 version, but I have updated the link to the 2022. Once you go to this link, you'll find something called as the tables and index as a zip file. You can download that zip file where you'll have a PDF version of the ICD-10 PCS. Thank you guys. Thank you for watching. Please make sure that you subscribe and support me so that I can do more videos going forward, including ICD-10 CM, CPT, and other things as well. I'll do a lot of videos in all the coding systems of uh, the CPT, HICPICS, and ICD-10 CM as well. Thank you.